video.
Rambo,
So the
she said, my free so my moon co-hosting to share and call forward. Now, don't want to so. Because they say no. Men person me logo off of you, me logo offer, and we be doing BB.
But you be too self why? I can't say you know.
okay, shall I mean so? You know, me bought that video way. I feel the me bought slowly. Say the better I can speak through it to you. Into prostate gland no, and a wahonom no, and on top of it no, baby bladder no is stored. The urine is stored in the bladder. And a huma way na Johnson fem echo through. So into one will say tube na Hannah Johnson a foul through here. Now call out. Oh, sorry. Sorry. So that's the normal urination process and how the prostate plays a role. Now, with the prostate, no, there's three things that affects the prostate. Prostate enlargement, and benign, the scientific term is benign prostate hyperplasia. This is tissue no ayekese. Now tissue no ayekese, both prostate enlargement ni prostate cancer no, tissue no ayekese emia urethra no into junso eba out kwapa na ntimi mba kese. Prostatitis no is just an inflammation of the prostate. The best tree word or closest to it, no, the best tree word for it would be say I say kuro about that prostate no. And no say no, we have treatment for it as well. Now, like I said before, the prostate cancer is benign prostate hyperplasia, which is enlargement of the prostate, which usually has no harmful effect. Prostate cancer is also enlargement of the prostate, but has possible effect. But I'm going to give a presentation where I talk about largely the prostate hyperplasia. However, most of the signs and symptoms could also attribute to the prostate cancer because both of them are enlargement of the prostate gland. Inti yana affecting men already bear 40 and upwards. That's when they start really seeing symptoms. Ni way of say or the quality of life, which means a decrease. It will be a junso crapa, junso kitsue be never. It will be a brain never. Just say on me, he's not. He begins to notice that in life is not as it was before. However, and it's not well understood. We believe that it affects men of different ages. So as you grow up, grow old, and as you can see, the percentage of prostate cancer, benign prostate hyperplasia, increases with age. And some people even think that it has to do with testosterone. Androgen may play a role in the development of this. Also, race. Almost who say before mema treatment from a younger age because of their high levels of testosterone, and it tends to affect them like in younger age. And then as they grow up and they start to notice the progressive symptoms, it becomes more pronounced. Asian men are least likely to develop these problems. Inflammation can also play a role. sometimes no certain bacteria yes say in one kitten yeah na almost cause problems in our bodies. A bit we say your friend E. coli, but we have medications for those things as well. So sometimes chronic infections can play a role. And this is the most important part of looking for signs of prostate cancer or benign prostate hyperplasia. Either one, you will have certain symptoms and signs what the while say no, and send me call doctor. First of all, no, na Johnson, I could general blood and me ba out. What moves out why Johnson do, Neso soon twinkle. Another one is say, cell person Johnson. Umia ho so pese okọ na so na ebia kitwa bi ebi so wadwun so awie no na ayese kitwa bi like wadwun so awie na you've just done everything and now for the ayese kitwa bi dwun so bi kitwa bi asan ba biom. So I said your flow, your voiding is not as good as it used to be before. Another thing they say ebia na jwada no sorry upese okọ dwun so no I say frequent urination in the night. And also so ya na upesa odwon so pa just say basa dendende ba okoso na kitu bi na aba. And I told you so sometimes no you feel like going so urgently so you end up doing it in the bed. But yeah, night getting up at night frequently is one of the signs of say you have LUTs or you have benign prostate hyperplasia and now say prostate cancer. Another more key thing is the color of your urine. See, when said light one is the normal color, and the dark one is the abnormal color. Sometimes the light one, abnormal. So the previous symptoms I mentioned now, it's over hospital. Now ube examine because any BBN your friend, sometimes we call it non-visible hematuria. The urine may appear like that, but you could still have underlying issues. So like I said, if you have the previous aforementioned issues now, it's important to come into hospital. Now, obviously, as you go further, it means to say the urine becomes more concentrated, more red. This is just blood in your urine. Blood sometimes comes from the vessels that are around the seminal vesicles na me can once earlier the blood vessel it's me pipe na akwakogun. Sometimes blood can come from upstairs, which is the bladder sometimes it could be cancerous. There could be cancer in there could be cancer in the prostate, which again can cause these types of bleeding. The dark urine is definitely some sort of cancer going on. Like I said, in all cases these symptoms, as well as the ones I've mentioned before now, please seek medical attention. Now, Uber Hospital, one of the things they say you better test it for infections because, like I said before, when one kitty be almost friendly organisms, if ever E. coli, the medications be more. Sometimes the infections can go away, and it can reduce your chances of progressive prostate hyperplasia and I said prostate cancer. Blood test be so your friend PSA, prostate specific antigen. And no smefan say prostate na certain chemicals be into your bloodstream. Into you take blood na sa chemical na higher. Not just you have either prostate hyperplasia and I say prostate cancer. Another test which sometimes I don't like doing it, but I've had to do it in the past. It's called digital rectal examination. And we just use our finger and insert it into the anus, and we feel for the prostate gland. If it's smoother, there's no problem. But if it has a rough surface, again, there's a problem. And see, when I say they put their fingers through, they are feeling for the prostate gland. And if it has a smooth surface, and reassuring. But if it's not now, it's something that we have to do further investigations. And see, Melbourne video in how digital rectal examination is done. Once a rough surface, initial one I'm the show, they will smooth surface. And sometimes no, it bleeds. And like the text underneath says, no, so when I attended to it now, it can grow and affect it can invade other tissues. Even if it's a prostate hyperplasia, it can still encroach on your quality of life, although it may not be harmful. Prostate hyperplasia is not harmful, but prostate cancer is. Okay, and other additional scans would be, say, ultrasound scan. Yeah, but your scan be to assess the size of the prostate. Another scan be your friend of cystoscopy. This is a procedure. My friend say the camera. It go through the tube now do so feminine. This shape through the tube, and no camera no inspected the whole bladder, inspect the structure of the prostate, just to see, say, if there's any structural abnormalities. Sometimes these symptoms can just be merely stones or tumors or any abnormality for the symptoms of such as, say, having blood in your urine. So we have to make sure, say, you best share those things. Until when it's just a camera that goes up there, urethra. And these are the management according to NICE guidelines. First of all, we do what we call watchful waiting. So initially, call hospital now, PSA, near blood test, all those things now. Now, doctor doesn't feel, say, your prostate is not large enough now. Obeka say, or large enough for surgical intervention. Obeka said there are things that you can do to reduce the likelihood of ABI. Nocturia. Nocturia is just getting up at night on a frequent basis to go and use the loo. Obeka say, okay, avoid drinking fluids just before you go to bed. And also reduce your consumption of alcohol and I say caffeine. And also double voiding, which involves emptying your bladder twice whilst on the toilet. It's good so one time. Now, if what's not swa, now if what try so by junso bio. This helps you empty the bladder completely. Now, say when it's me and keep you on top of those symptoms now the kind now say you're still having issues passing you to one junso do to one you're incontinent. So junso one. I think that the next thing what they do they say they give you a medication called tamsulosin, and no helps smooth the bladder muscle. Into a bladder muscle no relax it. Into junso junso need to be out easier. Another one too is finasteride, which again helps you pass urine easier. And there's surgical interventions as well. Back with your friend of transurethral resection of the prostate. It's very funny say, yeah, share prostate decide to say benign prostate hyperplasia. We will decide, say, okay, we will put it's like a tube inside your urethra, near scrape it inside. Yes, scrape it. That's the word resection. We scrape inside. So it opens up the tunnel, opens up the hole, so you're able to pass urine quicker. However, there are side effects to these type of procedures, such as some people have reported, say, erectile dysfunction and impotency have been reported in some cases. But in most people, we also find, say, they go back to their normal life after a couple of ABI, a couple of weeks, a couple of months. They go back to how they normally were. So, all sizes doesn't fit all people. These are some of the common side effects of taking certain those medications I mentioned, such as, say, what's one when you brew, what's one now I said why you're depressed. ABI sometimes I said and those types of common side effects of those medications. Into when we'll talk you through Into where we will talk you through the procedure if we find out, say, prostate hyperplasia. Once they all scrape the inside of the prostate, no extra and namna and yinina peno, ye be scraping in na ema kwaya da hwa ma wadwun so easily. Now, I'm going to just focus solely on prostate cancer. The other one was benign prostate hyperplasia. And Nono has a lot of overlap with prostate cancer. That's why I did it first. But more or less the same sort of presentation, the same sort of risk factors presents itself here. So again, with this, it's increasing in age, obesity, your chances of getting prostate cancer is high, it's increased in men. Also, obesity. So you have to watch your diet. Eating too much, and also increases your chance of prostate cancer. Also, high calorie diet has its place, its role in determining whether you get prostate cancer or not. A lot of foods are cancer causing. It tends to be maybe packaged foods, processed foods. I would say for prostate cancer, and I say just to get away from cancer in general, I think the foods I'm say if free that were planted, as in say bayere, bordie, what's it called? Kontomire, these types of foods, yeah, I said like it's not processed, much more better for you than sell back of baby that's in a box, anything with an expiry date, basically. Also, as I said before, it's the same here. Afro-Caribbean ethnicity for Black men, for some reason, they have a higher incidence of getting prostate cancer, and I said benign prostate hyperplasia. And also, if there's a family history, grandfather, and I say an uncle in your family, and I saw brother B, and I saw papa had it now, there's a chance you also could get it in your later years. So you have to be mindful of that. Be in your family now. try and make sure, say, every now and then you go to the GP to get yourself checked. Into prostate cancer nankasa no, and only presents it in itself in a way, say, initially no, feel bibia a symptomatic. By ding into no, you have to be science yambabe mention it. You have to go to hospital straight away. Because the reason why I say bad ding is because tumors nearby and back from the inside, a back or outside, outside the meat of the prostate. Into a chain and encroaching in, no sighting urethra no. Into na fe who say won't mention so. So sometimes no, who's are too late. Into no, so any symptoms. Ebia sometimes no bladder outside. Ebia Johnson deal. Ebia unya hesitancy. Say what to wow person Johnson. What to wow? I say Johnson jina bladder mu but to me but hematuria another one so say Johnson na moja ye woman. Please go to the hospital. And I say sperm moja woman. Again, go to the hospital. Sometimes we bet me pain, either in the testicles, abia scrotal area, abia in the back passage. Again, all of these things, no, please go and get it checked. And I have also a digital rectal examination where the doctor will put their index finger in the back passage to find out the shape of the prostate. Into when's the prostate cancer? I'm saying it to you. When's it started from outside? Blue a cancer. Into when's the agina outside? Into agina outside, sana emia hana Johnson fa emia urethra no. Into won't feel anything initially, but sometimes in yamiadom, sometimes you will get a blood because there's veins that feed this a cancer. No cancer no also here veins. They are vascularized. Into no sometimes ubenya say moja be free waba. Into moja ni free hoba ya na nefa ba ujun so ma usi na moja ye free hifa. You have to go and get it checked as soon as possible. And now if you look closely now T1 no small cancer ni stage no. Into small cancer na T1 I mean say tick. That means say you bet me even crap, you bet me a shahon a year free honum. Big ones, no, a year so big now. Sometimes we have to take out the whole prostate. A friend of that procedure and a friend of prostatectomy. Again, no, in other clinical manifestation of prostate cancer, no, is it's advanced disease. No, what happens with once the mechanical say initially no is localized within the prostate itself. However, no bedroom baby no cut into the regions when you have regional pelvic lymph nodes. It's na yes prostate no cancer no ejina landing Ghana of me free honum cut a quine home. Na fede o drew a free hoa with CM25 no so no a fast so echo Birmingham. So I said like and only a friend of metastatic disease no into a free lymph node now because the lymph nodes are there to protect you from infection. They are in your immune system, but also the things that you have fast work baby. I say roads, I say pathways. Into no, we find so ojina baby ojina no ojina ha na ye nye free wa otumi fast echo wakuma otumi lungs. What me fast so called baby into most of the time no. What happens with prostate cancer and say it do stage 3 crap. Sometimes doctors will how because it's stage 2 no free especially if you are at risk of getting you have a family history, you have all those risk factors I mentioned earlier. You are a bit on the older side, family history, have a high BMI, all of those things now can cause you to say, can make the doctor advise you say, I think the best thing is to get it removed. And sometimes no, and some of the other things that you will see, and move to regional lymph nodes, no, and move around the area of your pelvic area, no, you will find that onasia tate atatai nsuo. Ena ube who say just your groin area nankasa no, you feel well. You feel say there's discomfort. Ewo hono. Ena metastatic disease no, like I said, a sick kwan so a see high road so cancer will prostate meet me travel to let's say the lungs, and answer to the brain, to the heart, to wherever it wants to travel to. And only a friend metastatic disease, no. And it happens in all types of cancers. They can move anywhere they want to move to. And also there's sometimes rectal involvement as well. In terms of your prostate, the acid gets big and it encroaches on other structures. It is also from the beginning now. When say rectum no, it's very close to the prostate. In fact, to me far rectum touch prostate no. Now, when the prostate is getting larger and larger and larger, it encroaches on the rectum. Sometimes it can lead to constipation and now intermittent diarrhea because rectum now number 2 eba out. Sometimes can lead to abdominal pelvic pain as well. And also this can lead to fluid retention. So prostate cancer na bana mia urethra ne pa ujun sorry to me could jina bladder mu. Jun sorry jina bladder mu for a long time. It can cause infections and now say in fact it could go back to the kidneys. Then we start to say kidneys no. Kidneys no ain't mean son name to be because nema son name sonia kwa because normally the son name so na kwa go bladder name but say no bladder na yema and I say yema junso kitwe bi never out again no the investigations na yebe for benign prostate hyperplasia no is the same as for is the same as for prostate cancer. Again, it's bloods including PSA, DRE, which is digital rectal examination, and then MRI scan. No, it's a high resolution scan to see exactly how large the prostate is. You can even see the stage of the tumor, how far it is, how big it is, and whether it's operable. All of these information can be gleaned from getting a scan. In the past, they used to do a biopsy, but they say no, and like I said, no PSA no so as you get older, and because prostate cancer no it's increased with age, and our cancer growth no is increased with age, no your PSA goes up. So between the age of 40 and 50, no 0.25. Between 60 and 70 is 0.45. Between 70 and 18 is 0.65. So it increases with age. Okay, and before our hospital, so no, let's say you are coming to hospital for a test. Maybe you're having difficulty passing urine and all of those things. You recognize there could be something wrong with your prostate. Uber hospital, please make sure you don't do vigorous exercise. It's too bad. Just 48 hours before you come in. And also make sure you don't have sex before you come to hospital. The reason being is prostate PSA levels is raised in those circumstances, and it could give a false positive result. Another thing is urinary retention as well. It may prostate PSA high. It's important. And if you've had, like, let's say, a surgical procedure, or where you have to instrumentation of the urinary tract, you have to disclose this information. All this information, or catch your doctor now, they will hold off doing the PSA and do it another time, where they will get more of an accurate result of what's going on. So, all in all, what I would say is prostate is an important gland which God designed wonderfully. It helps produce semen, that allows for sperm to mobilize in when it comes out into the woman. It's also and when it comes into the woman. However, in disease states such as prostate hyperplasia, which is not problematic, and now say prostate cancer, which is problematic, you have to make sure you go to the hospital, get blood tests, get possibly even a scan, and then seek advice. But all in all, I think if you want to, as you get older, try and get an annual check every year. Go to the hospital, go to their GP and get an annual check. And when you're getting an annual checkup, specifically ask your GP for a PSA. Because sometimes also, some of these blood tests and all of those things, sometimes they tell us off for taking it because not a boy thing. One can do GP, some GPs are not going to do it because of cost issues. When you specify, say, I'm getting older, I need my PSA done. He will first of all know, you know what you're talking about. And second of all, also, he will do it. So that's it.
Oh, wonderful, wonderful, wonderful. Dr. Harriet. Akula wa kodro se kura de mi hu bi da. Nyama nyina na waka no.
I've tried my best in tree, but the tree the all my dake mo ano no.
Oya de nyame hira pa, nyame hira o. Eya sempa o, minuano, eya sempa. Book bi ne efe no wo safwa. So wo ba kromu a. Owo no akura de ne hu nya hu. Se na abofo na no mka ho no. Ye hwe benign prostatic hwe enlargement ni keke no hwe wo hu eniema wo yi kire yen. Enye yize kra, wonfa wo hu ni kra. Chese edin. Enti mo me hwe hu ye pa se ne wo ka no. Cells no ebegro ye nyine kɔ no de na bibia nso esesa. Enti ne ntempa no a na ya check. Se wokɔ na wo explain kire GP a sa digital one no de omuta ye pa. Enti moma yenso yentuma mpa na enye yize. Ebeduru ba bi na tina ye toa so a mo behu de besi akɔ. Ebeduru ba bi kura no be ma no ye de duru ba bi behyem. Tina bo me de bi beba na me de akyerem ye de behyem. Na afa Johnson no a enam grants no enlarge ntia akɔ aminya youth no a ntimi ma no ye de duru ba behyem. Na afa ye de abetale na afi wonam kra ne bɔ ho enyasem kama minia sa die we edi ye doctors ya no betimi akyerɛkyerɛ mu we de ebehia mo da o because we de ehia ne da bia da ye bebie kwan de adurei ama minim sɛ nsɛm de dɔso pa ye ntimi finish kra na akyenya mo ye beto aso enti no mi bie kwan no na obi ɛwɔ asembisa kwan da hɔ sɛ obetimi abisa na doctor wo so yi wa kyerɛkyerɛ mu so obi nso ewo emmoa bi ono so betimi de aboa ewo nsembisa no bi obetimi de aba eda wase doctor enti nsembisa ye bie atum
yo
okay so eda first second double tree
yo yeda yewura basi any doctor for me what can I say black people yeah
yes
now, research actually said yen diet is often the causation of this prostate cancer within the black community. They made mention of store milk. I am my ma and your mama. Sanomoka. Now, what they compare any Asia for year, Asia for diet, they got a lot of spices be or more. So we are researching what you say a bois prostrate. So okay. Now you need that line, you need that kind of herbs, I will take that kind of spice, we don't take them within the Asian community. But we are concerned the so-called soy milk. So it according to research, it increases your testosterone. So every morning be call a coffee shop. Alternative milk chocolate. One time be the restaurant owner no a black. He called me aside and told me specifically, say, I'm a black person and I shouldn't buy cocoa with the soy milk. In fact, me frase your whole research. Now it came to say it's one of the causation what young black people are fencing prostate cancer. So to me, a transit say now kind of it be a genetics. Fair enough. But young kasano, you do any be
Yes. Yes, I agree.
And Mimra, what is the level of PSA risky for people at the age of 50 to 80? What do you think is the PSA level? If we say
PSA level from 50 to 80, it will be around 0.45 to 65.
So automatically, when we do the PSA check, I said it's about this. Our GPs will call us. Will follow up with a call to come and see them. And I said,
absolutely.
Yes,
absolutely. Your GP is supposed to a high PSA. Your GP is supposed to call you and possibly even refer you to a urologist.
Good.
Because then that's when the urologist is going to advise you. It depends on what type. Is it benign? And answer, is it prostate cancer? Because if it's benign, what they will do is they will advise you on lifestyle and lifestyle changes, like you said, about dietary changes and all of those things. But say, if someone feels say much more sinister, a cancerous, then I think that they will proceed with giving you choices of treatments, which is sometimes surgical, and I say, surgical.
Okay.
All right.
Doctor, numbers no so to men's platform so nti wa ohia no betimi akɔhwɛ. Answer na Dr. Dabotwe beba no questions no dose nti no wo ba no ma na straight kakra na yetimi apeke mo. Dabotwe.
Yo, Dr. Harriet, thank you so much for your presentation. My question here, I have a friend that this experience. Now, according to no say, Okodana, no, so come. I feel dear chin, a Bob 5:30 to 6 to me. And I'm so ringy, so I'm got to Drubinia and on me. Afraid a drone rebel 6 or not, just say, to me, you have to rush him to the hospital. Now, you do come and have to take him to my house for him to pee before we take. I go to the hospital, no, he can't stand, he can't sit, he can't lay. And in person who say, Bassa, now I idea take a long time, because of a sudden, a chin of preoccupy.
It takes a long time. The answer make us say, once in the presentation, I said something like, say, oh, Johnsona, a bank getting seek attention, medical attention. So what to honor a Johnson Jones a day at once. Now open so Johnson, but not kids where be aba. And I say sometimes Johnson a deal, but meaning out at once. Again, seek medical attention, because it could be indicative of something happening around those urological structures I showed you earlier. It could be early signs, and with these things, the quicker you catch it, the better. The better the outcome for you.
Okay.
Because think about it, say a prostate hyperplasia, bet me to try namni be inside. Na ama will juice on a flow. But say let's say prostate cancer and kasa. When say it started from the outside, blue dots it started from outside. Na fe dia a chichire prostate in the con. So what I say. Yeah. But no, again, it comes over time. It doesn't just happen overnight. There would have been signs and symptoms.
Yeah. Okay,
Into,
thank you.
You have to be wary. Anytime make us say once a year checkup, dear. Don't joke with it. And our courses were specifically asked for PSA test. Because like I said, no, almost like every doctor is different anyway. But and every area is also different. Sometimes no. And I make I said the resources, because it's so limited, no, or that be big blood test, big crap, you know, you have to really justify it. But if the patient has asked for it, yeah, you put it in. Some doctors are more than happy to put it in.
Okay, thank you.
That's very doctor. So I check him. Be boarding into say one can. And I think some more testing and so I'm requesting print by print mamo. Call GP or bit me a print yamam. That's a name be a bit me will be bit me a church room. Nana hine ajiman.
Yo, opening me that's it. Doctor Associate Dawase, won't teach them all their my. Miss my question is TTT. PS in one seminar walk no. So corner say a doctor Maoko now koye. Na result no bana ofre no so mo kohwe bibia ni. Ah we okay. Na say wo ankasa so ofre say the okay kai ni na ba ko be na na me peti. So obu so a ebia uda anadwo a ebi obi obetumi asori adwo so be say ebia 3-4 times ansa na de achi na se wo test so na ebia you ka na no so sa no na e de ade a cause wo check PS no yes ebia you okay but to bere bia uda anadwo no anadwo na tasie wo ta asori dwo so ntem ana say ebia
no kwa say anadrunkwana ebia water sorry so so because that could also be there could be a psychological basis for that. It could be say ebia you're stressed in the night, ebia when you wind down and you try to sleep, that's when all the issues of life or whatever comes into your mind. So ebia you become naturally stressed. The question is are there other symptoms? If it's all to what just to me do in the daytime. The daytime, no. What's your peeing life like?
Okay, that's me to ask me pacho me ba. The ochire be Matthias here. Ojonso no, oko hospital check Ojonso see there's nothing wrong. Ojonso no so what the colors be chire. Color no ye bia first one na second one. But ebia prostate no na person check here. So check here PS no chire say adeso no normal. Na say ebia say dem di kan na. Ebia oda wo sorry Ojonso no what chire mu say ebia ada stress and say ebia tisa. Nti eba sa no a say continue. Now report to my GP and I say so ye day.
Sorry, my computer was a little bit unstable. I couldn't hear me patcho man so question no.
Doctor.
Me patcho what for man so question no.
Me more haka cry.
Okay.
Oh no, or can say or corner say urine your test BBI okay. PSA no so go no you okay. Still no or that Johnson or Johnson. The metimi the account is a doctor can ebi ana underlying symptoms bi wo ho enye prostate no kwa ana e man da bia obetimi adwonso sa na say wo fili urgency to bi ana e be diabetes symptoms say wo ye nya diabetes nso a eno nso etimi ma adwonso sa se nya wo kan ebi wo ho nso a na wo ye nya fluid overload eno nso etimi bon kaye e wo sa adwonso no ntinye kwa ana the meeting the one doctor
and I also know I'm going to back on what Mr. Dixon said. Also no fluid overload no na medications be higher than my Jones or but we are friend of furosemide. Another one we are friend of bumetanide. Show medication list more. Now those could be the reasons as well.
All right. So Nana, what you see there? Any Sister Dufie, Diana Dufie. Sister Diana.
Yo, me for me, my money now, your doctor, that's it. And not the same business. That was a cancer. No, a man, I'm going to me, and I'm mad to me, yabi.
Oh, Patrick, remember,
Me that's it.
Prostate is one of the only glands that are found in men. But yeah, remember, munya prostate cancer and our prostate hyperplasia because a specific to them.
Okay, and me that's it.
Yeah, that's it.
Review.
Doctor, I'm asking Musa question about Queen.
Yeah.
Doctor, almost can say blacks. In fact, I'm a nurse. Me share just say I know I'm say blacks na tembia ni bi wo ha say walking is prostate. And so me who say me opinion them who say mrofo no they are also likely because they say me clinic so obi ba me nye catheter aspect there but say me who say mrofo no be say 5 na be ba bibini ba kope so no so I don't see say e be enlargement in there wa fine e benya there but cancer no mu say prostate cancer no me hu say emrofo no so enya wo mo pa enti no say nhwemu mo kan bia black no no kre.
I think sir with every study you have to take
too much and so
yeah I think sir with these studies you have to take it with a grain of salt because yes me say me urology I think when I was an F1 and again because I did it in Kent and I thought say because I did it in Kent I hardly saw black patients but that's what the evidence suggests. I'm just gonna go with the evidence, but physically in Yana I don't see as it's true. I agree with you. You don't see as many blacks, but me dream say I didn't see many blacks because I'm in Kent. But so Kasa in London, then maybe there's something to it.
Yo, remember, Doc.
And yeah, my Michael, my Michael Kasansa, Michael, Eka say we are near Waba.
Yo,
Michael.
Michael. Yeah, Moha. What's the main case say?
Okay, Michael, that was
what's the main case?
Michael, yeah, Wabem, yeah, I don't can.
Oh, okay. The American is the survival rate in Ansoka. I want to say a George Alagaya, sir, a BBC newspaper, a newsreader. No, on an announcement for 42, Omunina the same cancer. Georgia win an for 42, no more white or Matthias. So, ain't he? Yeah, survival rate, no. It means survival dose any of those no but abrofono survival enti so omoka ebia statistics na interest ka say yenya more esne wo mo but ebia na omu nyina enya nso ye wusi na wo mo enti eno na me de ka ho say
omu nyina enya report eniema ntem
sa na say
possible.
Yeah. Or Tihono.
All right. And I'll say, Mike. Eda Bly and Sana Amaba.
Yo. Sir, yo medasi. So here, Nyamake kind no. Nifabine and Ukrainian statistics research no. Mostly is coming from US. Now so here US black population no. Ukraine, the cancer rate was low. The cancer rate was low in US. So than the West Indian community or any Afro-Caribbean. I mean the Afro-Caribbeans in UK. So we talk about our frequency in urinating in the night. And Udi Adriani beer. I said fruit beer. Obejus and Najupa fruit beer is say watermelon. And you would watermelon and Mimra and Najua who say sorry frequently, I coordinate. Then she said, "Oh, cancer." I remember beating what dance, especially within the men.
That's it. Ama.
Me pacho mami bia pejani sa. Pacho Dixon.
Queen why? What pejani sa?
Yes.
Ay manin ko anya sa obeka ze bully.
Ama na cause me unu ha. Ama, lay ni ama.
Queen why? What man is a
Oh, Queen why kind. Oh, sorry.
Queen why? Yeah.
Queen why, please.
Medase. Okay. Me pacho, me question am pese me booster doctor ne say uka say ya moye digital examination no. Me pese me who say if the rectum is impacted, ube there who say prostate na ye ragged and now say a smooth. Now what me am make you diagnosis no. Medase.
When the rectum is impacted, you can feel it. You can feel, you know what a hard stool feels like, and you know what not just that, no. When you put your finger in now, you put it at an angle. At an angle, if there's stool there now, you know what it feels like. Because you're feeling for a rugged surface of the what's it called? Of the prostate. But with the hard stool, no, you can press on a hard stool and it will you feel an indentation. So you know that there's a hard stool and the patient would flinch. And if you suspect there's a hard stool, now you can always do an abdominal x-ray. If the patient is impacted now, you can do an abdominal x-ray to, confirm your suspicions. And if they are impacted now, you can give them some medications to relieve them before you proceed with the prostate examination.
Yeah, that's it. Queen why? And I say, Juma. Yeah, Ama. Pacho Brem. So how many were the free? At the free.
Sorry, send me the mute. Maybe the end there, Dr. Damasipa need maybe there no prevention. Yes, prevention is better than cure. Inti enuane besa na hunu ha se on se tomatoes no ne veggie fruits ne ada no se mo betimi ahye mo kina se saa ne ma ne yebita adia yinti meka sa tomatoes ye stew aye nyina tomatoes ye beno asa na aye grease inti what kind of tomatoes fresh ones no any nuane besa ne yedia ebetimi prevent you from getting prostate cancer.
So like I said, no, things that are processed. Into BBI, me find say what thing mono try and avoid it. BBI me find say what's a fufu I what cutting mono. So be fufu I bet me ko to banche fresh no twitwa no one na wo de blender mo no aye fufu that way if you feel like having fufu. So there are alternative ways of making the same types of foods rather than going down the processed route, no. And a meat in the olden days, no, ABR sometimes the meat akoko base me akoko with no problems. But these days, no, all the hormones man go kono. Inti no udi aduane na hormones na ko na hormones na suka can cause destruction to your body in any aspect of your body. So and now these days, no, unless I na akoko ni free Ghana and I say akoko ni free unim say it was having organic food, but krom han namne na se for Diana they put a lot of hormones in it. Again, so krom ha enam there I will avoid it, but I will add more fruits, vegetables. When you compare it to let's say it's much more healthier if you think about it. But yeah, I'll consider more fruits, vegetables, and stay away from tin foods, anything in a tin with an expiry date, anything with an expiry date, no. Yana, they put additives in it to preserve it for longer. But a cold body more, those additives, no, can be detrimental.
Okay, now fruits, no, but all kinds of fruits are now. There's going to be exemptions.
I think so. You can eat. I haven't researched into that so much, but I think so.
Okay.
All types of fruits should be okay. I think so. All types of fruits should be okay.
Okay. Thank you very much.
Harriet, yeah, that's it. The free metro say we are to prostate foods. You share doctor dietitian. Harriet, why are they? Yes.
Okay.
Root way, Pacho. Root.
Yo,
So root.
okay. If I show number so.
Okay.
If I show say research in who near my near can say if you are normal bias no and who has some crab in America. Say me studies yes that cause near my win mukakra. Say in pain baby no research maybe why normal Eddie akoji sika kesibi from pharmaceutical companies and all the other things. Into maybe a bias. And nyina na ya gitum. It's in Pembe no. The research ni ebeja tumu pa na bi wo ho a na kese ya kan sample ya swande so pa hu say no kore. Anase ye wo nkrofo bi a omutimi ye wo omuti edihwehwe eniema mu hu sade kon na omo ye na it's from the right source. Ebi wo ho omutimi you ema ebinu placebo na ebinu so wo ho a omo de enroke ankasa na emo omo ye that kind of studies bi ema ye tie bibifo say ye catch them say ye placebo enso na say enro pa na ye dey ma wo mo enti in the long run yes bi echi no ye hwehwe mu no na bibifo a ye dey yes say placebo na ye dey ma mu nyina no ema bibifo no nyina be wuwi ema eka abrofo no kwa ye hwehwe mu no na abrofo no de ne aye to say de ye be ka ne say ensuo na ye dey ma omo enso na bibifo de na enupa no ne de test wo mo ma omo be wuwi enti ne wa bebre na ekoso na enso no ne nyina mu no mum ye ntie enokure na ye ka kire ne nyina ye hwehwe ye didie ene ne ye nom yie because nye de time bi ye ka kire ne na wo se agitum ne ya ye hwehwe ye hu yie ne ye hu se Africa na no papa sorry wo say okay masam na e ba wie enti mum ma ye nyina ye hwehwe ye hu yie se ne na ayi doctor yi ni wo keka ho ka kire no ne ntie na ye nkwa na timi aye tenten medamase
That's it. The meeting can say research the perfect that there is bound to review. So mama any research the yenimna yes and I say the catcher and yamayan yenim koso and bit me aboy. Mrs. Beatrice why please.
Yo, medase open deck say Dr. Harriet yadase pa nyamishra yadase papa yadase na masimbi saye tamsulosis na kind of many urologists be kasai na no ebu wa onu ma itimi uni blood pressure itimi resume blood pressure ma wo benya blood pressure na osi ba ko bi so ende mi refi ni din kakra no so eno so betimi ama wanya se wo glaucoma wo mabusua mu a eno sa no wontumi no enti okay medase but kakra mpesa me ka say me yen kunu ne yen papa no pastor me so me futo kakra me de mamu no me nye doctor de bet me urology theater kakra mpesa me kan say wo chance manage a chair said Dr. Harriet kanu ye de oba ne be cystoscopy a glands no ye eno na ye beti ombetwetwa bi kakra sa betwetwa no bebre ne ya so ne so ne ade akọ histopathology akọhwe ente ya mama ne nche said to be na ho say urologist ne bi on ka say patient ye bi a okohu GP ntemu a anka beboa me wo family friend bi onye azie ni mo ye dro be ma se me ne de nkomo we ka kire ne say be ma nse wo ye kese bebra ene diabetic ne nam ente ye on hwe ne weight ne tam odidi ye ti me kire ne so wo ya onko work kakra okọ adwuma de bi oteka mu asese nyame ado obo no mo na me san ka kire ne say na ne prostate nso wa hwe ho asem on country GP na GP refer no nti na me kan ya wan fan to kra na GP refer no anche no koye wo am say home atena na say no wo catch me say omo oye text no all my friends home hu bibi nti no besan ya frɛ ne biom nkomo keke na nyame adom ne nti mema no mesrɛ mo a na nso say no mo say ye mmoa mo dia na mo nkɔ hospital na say ankoye too late o kɔ ntem a nyame adom bɛboa but eto be hospital ye kanka krakra mo nkɔ enso dana mama ya ate ase say ye mmoa mo nti say de nyame adom ye bɛboa mo ye kase mo nkɔ hospital na mo nkɔ na nye late. But Dr. Harriet Mpacho tamsulosis in the obetimi actually akam wasem kakra me da say nyame sure be brave.
Okay, so tamsulosin is a medication na yedema patients because you per se or you lose bladder no a little bit more loosened. Now, if we give that medications to you now, when the bladder is more relaxed, it means that Johnson say urethra no say prostate na urethra no crap Johnson kakret me fem. But this can work up to a certain point. To the point where the prostate encroaches the urethra so much, say hardly any urine can pass through. And then we have to go down the surgical route. Yes, with most medications, there are side effects. Off the top of my head, I think I mentioned some of them. Some of them is dizziness, postural hypotension, which is blood pressure actually drops. You feel weak, you feel lethargic. Sometimes they lose their let's say their sex drive, their libido, in the inability to want to engage with their spouses. So yes, it can have side effects. I think that's also true with finasteride, which is another medication which does the same thing. It hastens the symptoms of prostate cancer and benign hyperplasia. But it's not given for forever. There will be a point where the patient will need a surgical intervention.
Doctor. Letitia. Say Letitia cannot
another thing, so a person may count say, surgical intervention, excess meat need be free more. Sometimes no doctors be why they will review your tamsulosin no. Any your finasteride, no catch you say stop taking it altogether because you're passing urine fine and you don't need to take it. So some doctors will tell you to stop it.
Doctor. Say next Friday time no so ekonanim. Letitia and Mrs. Comfort Anson, Pachomubia na fe ye dijumedie no. Letitia.
Your doctor me that Nyamisha pa Mr. Dixon Nyamisha. Na no Pachomi bisa say na o kan kind money man me pasadi pa me dey stew de bia ti be say mu say no so anya na
Daddy sardine
I now can tin money man say tin money man
yeah tin food Yana there's rather no if I were you I may use fish itself
okay
rather than tell bit because tin once Yana it comes in preservatives yana all types of things are inside. And I won't say Western world no America ni UK ni na say for no when say we have a higher incidence of cancer than countries that rely on natural foods like let's say Ghana or Nigeria or any of those African countries. If you compare now, you're more cancer than they do. Yes, so we are meant to be more advanced. It's because we rely on more tin foods, instant noodles, instant tin tomatoes. For Ghana, and I say fresh tomatoes. So that's the difference. And I believe, my personal belief is that processed foods, and those processed foods normally additives it has consequences. And one of them is cancer.
That's
last question, that was the doctor. Comfort Anson, last one.
That's you. My question person me bisa say ABA now underlying symptoms no more than 3. Now what you test test no so ba as borderline. With GP anya hwe amfa ho. Ose we okay. When say ma bi twese kan no say woko hu specialist na bi oye investigation a obeka say ebia patient we hu ni GP ntema anka ankodu ebia bibia du no.
Yeah.
Nti na wo GP no so na ebia we betray wo. O test by you say okay. Also yet still no now what symptoms no. Nti edu sa na then I'll be to me aye. Because you know say there might be something wrong, but GP no is not helping you.
Ooh. Yeah, it's a tough one. But no, if I were you, I could make a walk-in. You know, these walk-in A&E places you want, a big hospital, a walk-in big hospital, and explain to them your symptoms. So what I say, I think that from there, no, you'll be able to get a sympathetic doctor who will then refer you to a urologist. Because ideally, no, even borderline symptoms, no, a doctor should refer you. A doctor with symptoms, no, yeah, a doctor should refer you. But sometimes there are all kinds of reasons why they don't, and sometimes they are resources.
Thank you.
All right.
So when your symptoms you're really concerned about that. Yeah, GP is not doing anything about it. I would suggest say you go into an A&E. Go to A&E and explain to them what is happening to you. And it's very, very difficult to get a urology referral. Explain to them, say your PSA levels is high. You're having symptoms, but your GP has not been referring you.
Thank you very much.
Doctor, what do say prostate who has some near Kamema dear? But yet you say man so drew baby retention. So what prostate so when prostate drew a man's money be dear, but near urinary retention. Ube who say when Timon so na fear dear ashe nasi and I said and so I didn't let me pass. Fancy last question.
And no, Yana, it has to do with bladder cancer. The bladder itself, can become cancer. Once it's a muscle, it's a balloon, you're turning it upside down. So it's like a muscle in itself. If I show you, it's like a muscle, it's like a balloon but it's a muscle that can become enlarged. Oh, is this oval-shaped a structure? But it can become enlarged. I said, the volume of urine a bit me a store is not as much as before. Until you buy and I sometimes just so you have the same issue, you have the same symptom as somebody who wants to pass urine. I mean, who has benign prostate hyperplasia and prostate cancer, but women don't have prostate, so they wouldn't have that issue. I think, say, what was the question? You said, say, how say women get retention? Women get retention because of sometimes tumor or sometimes stones.
Okay.
Ureteric stones. I mean, yeah, it could be stones and I said tumor. Those are the things that I can think about that could cause retention in a woman.
Thank you, doctor. Thank you. But so I catch a papa na da obesa ba no yehu na we de ebe hia o da bia yeda masem adaje yankopon ya adom a we ye nketo akra na me ya adom a chiron besa to aso ho no de question bia bothering bia no fabra na omo be ya no ama yeda wase Harriet nyame nhira omo ahoden ni se obema onim die amana kọ animu ama watimi nso de bo aboa yin yeda mase se nkaibo bi ani ho a quick nkaibo bi wo ho a quick one obi yemfa mfam na afei pastor emompaye emayen na yenyina na yenko se nkaibo bi ani ho
pacho nkaibo kakra oni so may you freeze you have to open another one. Open Dixon ya dase ya jamfu ya dase Only ekra. Ama enyina yehunu ne e wo se ye. Kamo kakra wo say na ye planning senke be blood donation. But unfortunately no ya starting term. Inti ama normal a bit late say a bit me aye say blood donation no this Sabbath year be. But you know more come I planning for another time. Inti so far na China blood donation no ain't me maso, but we are planning for another time. Say kakra me kafa blood donation no. Inti mano si me da mo ase.
Thank you,
But
Elder.
obi bia oba bia ase say onya akonya mai da mo ase.
Pastor, any dear man, oh dear, Becco, I don't want him any. The pastor was
Not for no Mr. Moma, Mumpaye. Dr. Harriet, Nami in Shrap, Papa, Dixon, so Nami Shrap, Vivian, so Nami Shrap. Yo, your bumpaye. Yet I was sick when I was so. You are here come forward and umre, your now don't so a dear a bit drony, and she say, Pa, why am I yen a fat men's ministry for? Na what tree mo, where shrine am I who send you when I may? Ope say your boy ni pedua ho ban titru mema se ebeya ya setran betimi wie peye na ya tena se ache na ya hwe ye ma ama ye nana no mpo abeto yen ye da waso sa hyehyɛ ye peye ho yesro pautro ye nipa ebia ye ankasa ne ye lifestyle bi no ama nima bibre ne di hwamo ama akotwe yade ene abebrese ne how bibre abre yen yesro fa che yen ne na ya ti bo yen ma yentu anamompa bi a ebeboa yen ama yen apomden na yetimi de atrase asomwo se mu bi mpo ewala iso eninya yade bi eninya wo haw bi a etete won ha wo mu a na yate yi no besro ma wayare satumi no enadi na ekyew tumi yeda wase wo bra ye fru wanem na yakodai hwe yen so na ebo ye ho ban anadwi siesie yen ma adetipa ha fefe no sani wanu nam tie no ti ma wabofo ama ye ho ban misro ye free sign amane petuwo anadu bumbo how biara mu nemu no sa adetipa ha fefe no to ye ne da so tinkwamu a misro kaka wo ma wo na ye mfa asida ene ayeye ma wo tin klonkron yeda wase ne odi abetri to nyame ma Iradin shramo radin trenem shramo mama modin siye radin koso ma kokodro ni hu ni sro emfri mu odo yefo no ono ani Jesus Christ how no ba dan ne toa no sufre no obeje so ayaresa no be kese na obenya fa hodie ama okra onyame no shramo no ma yenu masam ye ne fe na yekuma mu nkomo so nani enana twi Jesus Christ dem amen.
Amen. Yo, as announcement, kitu ebi eka and say echina wia Harriet Beba, Dr. Kwachin so and Mami Augustina so we will try see me put you on online. It's questions and answer bia when tiye misa 3 sessions ya yina no. Echina wia no akunya wo say bibi abeso say bia betimi bisa. Edamas.
Damasi. Yep. Vespa.
Yehowa ɔnhwɛ yɛn ntɛm. Amen.
Amen.